My name is Dr. Mathai. I am a colorectal surgeon working in Apollo Hospitals in Jubilee Hills. Today I'll be talking to you about incontinence. Incontinence is basically the inability of a person to control their passing of stools or flatus. This is an extremely common problem in the general population, and it's estimated that about 7% of the population in the world suffers from this problem. The unfortunate thing is that many of them are told by their primary care physicians that there is no treatment for this. The symptoms that one has is that when one has the urge to pass stool, they cannot control it, and if they are not close to a washroom, they tend to soil their clothes. Now, this problem generally occurs in women who have had children and in anybody who has had surgery in the anal region. The classical history we actually get from many of these patients who come to us is that if they have to go for a movie or for a wedding or some function, they don't eat the whole day simply because they are scared that if they do eat and they have the urge to pass stool when they are outside the house, they may soil themselves. So many people tend to starve themselves for a day if they are going out in the evening or for any function at all. There are multiple treatments now available for this. When a patient comes to us, we try and assess the severity of their problem. There are multiple tests to do this along with the physical examination done by the doctor. We do what is known as a manometry test to see the strength of the muscles, and we also do a scan to see if there is any disruption of the muscles. Now, depending on the severity of the problem, we can either treat the patient medically or surgically. Medical treatment will help in patients who have only mild incontinence. In those with severe incontinence, some form of surgery will be required. Re-repair of the muscles if the muscles are cut so that the muscles are made whole again, or transfer of muscles from one area. We sometimes need to take a muscle from the leg to wrap around to help the patient control their stool. The results of these operations and medical treatments are good, and most patients, about 80% of patients, show an improved ability to control, which increases with time. In other patients who the muscle is not too badly damaged, we do what is known as a feedback mechanism to help them with a special machine to help them increase the strength of their muscles. If somebody finds that they are unable to control their passing motion for any period of time, that is, they have to rush to the bathroom or that they soil themselves before they reach the bathroom, it is best to see a specialist doctor at this point of time. The Department of Colorectal Surgery handles this kind of problem and takes care of the problem both medically and surgically. The non-surgical management of these patients includes strengthening of the muscles with a special machine which is called biofeedback. Specialized nerve stimulators are there with which we stimulate the nerve to increase the tone of the muscle so that the whole muscle strength increases, and sometimes this alone will completely help the patient and avoid surgery. Thank you.